A 12-year-old boy sits in a doctor's office. His stepmother convinced a physician that he was unruly and needed to be fixed. Without anesthesia, the doctor places an ice pick above the boy's eye socket and hammers it into his brain. The boy's name was Howard Dully, and what happened to him was completely legal. Between 1940 and 1950, 40,000 Americans had their brains pierced with ice picks in a procedure called the transorbital lobotomy. Doctors claimed it would cure mental illness, make violent patients docile, and transform problem children into obedient citizens. Instead, it created a generation of brain damage victims who were left emotionally hollow, cognitively impaired, and forever changed. The man responsible for this medical nightmare was Dr. Walter Freeman, a neurologist who believed he could solve society's mental health crisis with a simple tool that resembled an ice pick. But Freeman didn't invent the lobotomy. That distinction belongs to Portuguese neurologist Antonio Egas Moniz, who developed the procedure in 1935. Moniz called it a leucotomy, and he won the Nobel Prize for Medicine in 1949 for his work, though this award would later become one of the most controversial in Nobel history. Moniz's original procedure involved drilling holes in the patient's skull and injecting alcohol to destroy brain tissue in the frontal lobes. The operation required a surgeon, an operating room, and took considerable time. Freeman saw an opportunity to streamline this process. In 1945, he developed what he called the transorbital lobotomy, using a tool he named the orbitoclast. This instrument looked exactly like an ice pick, and Freeman's technique was brutally simple. The procedure began with the patient being rendered unconscious through electroshock therapy, not anesthesia. Freeman would then insert the orbitoclast above the patient's eyeball, between the eye and the upper eyelid. Using a surgical hammer, he would drive the instrument through the thin bone of the orbital roof and into the brain. Once inside, Freeman would wiggle the tool back and forth to sever the connections between the frontal lobes and the thalamus, the brain's relay center for emotions and impulses. The entire procedure took less than 10 minutes and could be performed in a doctor's office. Freeman believed he had revolutionized psychiatric treatment. He marketed his technique as a miracle cure that could transform violent, unstable patients into calm, manageable individuals. What he created instead was a medical horror show that would destroy tens of thousands of lives. Freeman's background makes his descent into medical barbarism even more chilling. Born in 1895, he came from a family of doctors and was considered brilliant by his peers. He received his medical degree from Yale and specialized in neurology at the University of Pennsylvania. Freeman was articulate, charismatic, and genuinely believed he was helping people. This wasn't a mad scientist working in isolation, but a respected physician who convinced the medical establishment to accept his brutal methods. The doctor's personality played a crucial role in lobotomy's spread. Freeman was a showman who loved attention and drama. He would perform procedures in front of audiences, sometimes using both hands to operate on two patients simultaneously. He took photographs of his patients before and after surgery, creating a grotesque archive of brain damage that he used to promote his work. Freeman even allowed journalists to film his procedures, turning medical operations into public spectacles. Between 1940 and 1950, approximately 40,000 Americans underwent lobotomies. By 1951 alone, over 18,000 procedures had been performed. Freeman himself conducted or supervised roughly 3,500 operations, many performed without a surgeon present and without proper sterile conditions. He traveled across the country in what he called his lobotomobile, a van equipped to perform the procedure, bringing his ice pick surgery to mental hospitals and psychiatric institutions. The scale of this medical disaster becomes even more horrifying when you consider the speed at which Freeman worked. He could perform multiple lobotomies in a single day, sometimes completing the procedure in as little as 5 minutes. His record was reportedly 25 lobotomies in one day. Freeman treated brain surgery like an assembly line, moving from patient to patient with mechanical efficiency. The patients who received these lobotomies were predominantly women and institutionalized individuals. Many suffered from depression, schizophrenia, or anxiety disorders. But the criteria for lobotomy expanded to include conditions that wouldn't be considered mental illness today. Patients were lobotomized for migraines, chronic pain, and even behaviors that doctors labeled as nymphomania. Children as young as 12 were subjected to the procedure if their parents or guardians complained they were difficult to control. Women made up roughly 60% of lobotomy patients, reflecting the sexist attitudes of the era. Behaviors that would be considered normal assertiveness in men were often labeled as mental illness in women. Wives who challenged their husbands, daughters who rebelled against their parents, and women who displayed sexual independence were all potential candidates for lobotomy. The procedure became a tool for enforcing social conformity, particularly among women who didn't fit traditional gender roles. Howard Dully's case exemplifies the casual brutality of Freeman's approach. His stepmother convinced Freeman that the boy was defiant and needed to be cured. Without consulting other doctors or exploring alternative treatments, Freeman performed the ice-pick lobotomy on the 12-year-old. Dully would spend decades dealing with the cognitive and emotional consequences of having his brain damaged as a child. The story of Rosemary Kennedy, sister of future President John F. Kennedy, illustrates how lobotomy affected even wealthy, powerful families. Born with mild intellectual disabilities, Rosemary became increasingly difficult to manage as she reached adulthood. In 1941, her father, Joseph Kennedy Sr., authorized a lobotomy without consulting his wife or other children. The procedure left Rosemary severely mentally impaired and institutionalized for the rest of her life. The Kennedy family kept her condition secret for decades, demonstrating the shame and stigma that surrounded lobotomy even among those who had chosen the procedure. If you're interested in learning more about how medical procedures can go terribly wrong throughout history, make sure to subscribe because we cover the darkest chapters of human experimentation and medical ethics every week. The immediate consequences of ice-pick lobotomies were devastating. Approximately 5% of patients died during or shortly after the operation. Those who survived often faced a lifetime of severe complications. Many became apathetic and emotionally blunted, unable to experience normal human feelings. They displayed childlike behavior, lost cognitive abilities, and suffered from incontinence and seizures. Some patients became so impaired they required constant care for the rest of their lives. The personality changes caused by lobotomy were profound and irreversible. Patients often lost their ability to plan for the future, make complex decisions, or understand social cues. Many became impulsive and inappropriate in their behavior. Some lost their sense of empathy and became callous toward others. The procedure didn't just treat mental illness, it fundamentally altered who these people were as human beings. Freeman defended his work by claiming that lobotomized patients were easier to manage in psychiatric institutions. He argued that even if the procedure caused personality changes, it was preferable to leaving patients in their original state of mental distress. This logic revealed the fundamental flaw in Freeman's approach. He prioritized institutional convenience over patient welfare. The goal wasn't to cure mental illness, but to create docile, manageable individuals who wouldn't disrupt hospital routines. The economic factors driving lobotomy's popularity were as disturbing as the medical ones. State mental hospitals were overcrowded and underfunded. Caring for thousands of patients with chronic mental illness was expensive, and politicians were reluctant to spend taxpayer money on psychiatric care. Lobotomy offered a seemingly cost-effective solution, turned difficult patients into manageable ones with a quick procedure. Hospital administrators embraced lobotomy because it reduced their staffing needs. Lobotomized patients were less likely to be violent or disruptive, meaning fewer attendants were needed to supervise them. The procedure also freed up beds, as some patients could be discharged to their families after surgery. From an institutional perspective, lobotomy was a financial success, even if it was a medical disaster. The lobotomy's popularity stemmed from several factors that reflected the sorry state of mental health care in mid-20th century America. Psychiatric hospitals were overcrowded and understaffed. Effective treatments for mental illness were limited, and many patients spent years or decades in institutions with little hope of improvement. Freeman's procedure offered what appeared to be a quick solution to a complex problem. Freeman was also a master of self-promotion. He courted media attention, inviting journalists to witness his procedures and providing them with dramatic before and after stories. Newspapers and magazines published articles describing lobotomies as breakthrough treatments that could transform violent criminals into productive citizens. Freeman traveled extensively, giving lectures and demonstrations to medical professionals who were desperate for new treatment options. The media's role in promoting lobotomy cannot be overstated. Popular magazines like Time and Newsweek ran articles praising Freeman's work. The Saturday Evening Post published a glowing profile titled "Psychosurgery, a New Weapon Against Mental Illness." These articles rarely mentioned the procedure's risks or long-term consequences, instead focusing on dramatic success stories that Freeman carefully selected and presented. The simplicity of the transorbital lobotomy made it attractive to cash-strapped institutions. Unlike traditional surgery, it required minimal equipment and could be performed quickly without an operating room. Hospital administrators saw it as a cost-effective way to manage difficult patients. The procedure's office-based nature also meant it could be performed on outpatients, allowing families to have relatives lobotomized without lengthy hospital stays. Freeman's technique also appealed to doctors who lacked surgical training. The transorbital lobotomy could be performed by psychiatrists and general practitioners who would never be qualified to conduct traditional brain surgery. This democratization of psychosurgery meant that thousands of physicians across the country could offer the procedure to their patients. The international response to Freeman's work was mixed. Some countries embraced lobotomy, while others remained skeptical. The Soviet Union banned the procedure in 1950, calling it contrary to the principles of humanity. Japan adopted lobotomy enthusiastically, performing thousands of procedures before eventually abandoning the practice. European countries varied in their response, with some embracing the technique while others imposed strict regulations. But by the mid-1950s, the medical community began to recognize the true horror of what Freeman had unleashed. Psychiatrists and international medical organizations started condemning lobotomy as a barbaric procedure that violated basic medical ethics. Critics pointed out that Freeman had never conducted proper scientific studies to evaluate his technique's effectiveness. He had no follow-up data on long-term patient outcomes and had ignored mounting evidence of the procedure's devastating consequences. The turning point came when other physicians began conducting systematic studies of lobotomy patients. These investigations revealed that the procedure's success rate was much lower than Freeman claimed. Many patients who appeared improved immediately after surgery actually experienced significant cognitive and emotional problems in the years that followed. The studies also documented the high rates of seizures, personality changes, and other complications that Freeman had downplayed. The introduction of antipsychotic medications in 1954 provided the final blow to lobotomy's popularity. Drugs like Thorazine offered psychiatrists a way to manage patient symptoms without permanently damaging their brains. The medication revolution in mental health care made lobotomy obsolete almost overnight. By the 1960s, the number of lobotomies performed in the United States had dropped dramatically. Freeman continued to advocate for his procedure even as the medical establishment turned against him. He was eventually banned from performing surgery at several hospitals and faced increasing criticism from his colleagues. In his later years, he attempted to track down former patients to document the long-term effects of their lobotomies, but his findings remained largely unpublished. The doctor's final years were marked by increasing isolation and bitterness. Freeman couldn't understand why the medical community had turned against him. He continued to believe that lobotomy was a valuable treatment that had been unfairly maligned. Freeman traveled the country in his later years, tracking down former patients and documenting their conditions. What he found disturbed him, but he never publicly acknowledged the full extent of the damage he had caused. The legal system's response to lobotomy was limited and came too late to help most victims. A few patients and families filed lawsuits against Freeman and other doctors, but these cases were difficult to win. The medical establishment had endorsed lobotomy, making it hard to prove malpractice. Most victims were too impaired to advocate for themselves, and their families often felt shame about having authorized the procedure. The legacy of the ice pick lobotomy serves as a cautionary tale about the dangers of medical overreach and the importance of rigorous scientific standards. Freeman's technique was adopted widely before being properly tested, and thousands of patients paid the price for this medical recklessness. The procedure's popularity reflected broader problems in mental health care, including inadequate funding, poor understanding of mental illness, and society's desire for quick fixes to complex problems. Modern psychosurgery exists, but operates under completely different principles. Contemporary procedures use advanced imaging techniques to target very specific brain regions and are considered only when all other treatments have failed. These operations are performed by teams of specialists using precise instruments, not ice picks hammered through eye sockets. The ethical standards governing modern psychosurgery are strict, requiring multiple consultations, informed consent, and careful follow-up care. The transorbital lobotomy represents one of the darkest chapters in medical history, a period when doctors believed they could solve human psychological complexity with crude brain damage. Freeman's ice pick didn't cure mental illness. It created a new category of suffering that lasted lifetimes. The procedure's rise and fall illustrates how medical progress can sometimes move backward, how good intentions can lead to terrible outcomes, and how the most dangerous people are often those who believe they're helping. Today, Howard Dully is in his 70s. He spent decades struggling with the consequences of his childhood lobotomy before finally learning the truth about what had been done to him. His story, along with thousands of others, reminds us that medical progress isn't always linear. Sometimes the most dangerous people in history are those who believe they're helping, and sometimes the most devastating experiments are the ones that seem the most reasonable at the time. Freeman died in 1972, never fully acknowledging the damage he had caused. But his victims lived on, carrying the scars of his ice pick in their minds forever. What Freeman discovered in those damaged brains would shock him, but that revelation came too late for the thousands who had already paid the ultimate price for his ambition.